welcome any members of the public attending the meeting. So we welcome Dr. Howard Purcell is the new member of the Statutory Advisory Board. We'll ask Dr. Purcell to tell us a little bit about himself, but for purposes of interest, since we've never met, or at least I've never met Dr. Purcell, I'd ask each member of the SAB to introduce themselves and talk about your professional affiliation. I'm Joe Abley. I had a long career in business and had served on the board and then as the president of the Carroll Center for the Blind in Newton for many years. I'm currently, in addition to my position on the Statutory Advisory Board, am on the board of directors and the executive committee of the National Braille Press. Amy.
Hello, I'm Amy Rule. I currently work at the Massachusetts Association for the Blind and Visually Impaired as the Director of Social Services. I'm also on the national board for the National Federation of the Blind, and I hold many positions on relevant boards, including the Disability Rights Council for the AG's office, the Perkins Library Advisory Committee, and the Braille Literacy Advisory Council, and several other posts as well. And nice to meet you.
Excellent. Kim.
Yes, thank you, Joe. I'm Kim Charlson, and I work as the director of the Perkins Braille and Talking Book Library in Watertown. And on the SAB, I represent the American Council of the Blind. I'm the immediate past president of ACB, and I'm also the current president of the North American Caribbean region of the World Blind Union. So that's something we can talk about in the future. And I didn't realize how many boards that Amy and I sit upon, but the same Attorney General and the Braille Literacy Advisory Council. So we meet often and work collaboratively together. So it's great. Thank you.
All right. Thank you. Susan.
Yes, hi. Thank you, Joe. Thank you, Joe. This is Susan Foley, and I am at the Institute for Community Inclusion at UMass Boston, where I oversee a unit on doing research, technical assistance, and some training on various vocational rehabilitation practices implemented across the country, and have been happy to be part of the MCB Statutory Advisory Board for a few years. So welcome, Dr. Purcell, and nice to meet you.
Okay, Dr. Purcell, tell us a little bit about yourself.
Thank you, Joe, and thanks to all of you for introducing yourselves. I appreciate it. Obviously, a distinguished group who have contributed a great deal, and I'm looking forward to contributing however I can. I have to mention, when I hear in Carroll Center and Perkins mentioned a couple of times, these are institutions that our institution has close relationships with, and we're very happy about that. So, as is mentioned, I'm Howard Purcell. I'm an optometrist. My career has been an interesting one, but started as a graduate of New England College of Optometry. I'm a second generation graduate of the college that I'm now a part of. My father went to school here back in the late 50s, and I went to school here in the late 80s. So it's wonderful to be back. I currently serve as president and CEO of a 128-year-old institution. Has always been in the Back Bay. We are the longest continuously running optometry school in the country, and very proud of the team here. In particular, I have to say, very proud of our low vision and vision rehabilitation group. We are particularly happy to have Janet Lebrecht as part of a member of our board, and Janet has continuously told me, in addition to the commissioner, what a wonderful group this is and the great work that you do. So Janet is an incredible asset here, as you can imagine. So I've been in private practice for about 10 years. I've been in academia about 5, but the majority of my career, 25 years, has been in industry. I've been part of the Johnson & Johnson family, and also a French company called Caseloads, the #1 spectacle lens maker in the world. So pretty diverse career. I've been very fortunate. I don't consider myself necessarily an academic, but I am thrilled to be back at my alma mater, surrounded by people who really understand academia and trying to bring some change and advancement to the college while we implement a lot of different technologies and issues like artificial intelligence, virtual reality, 3D printing, telehealth, things that are really changing our world in general, but certainly changing the field of medicine. So particularly proud of all the great work that MCB does. I see the results of your work every day in our clinics. And so congratulations, and whatever small contributions I can make, I will do my best to do so. But thank you for the welcome.
All right, great. Well, thank you. So off to the agenda. Dr. Purcell, did Regina send it along to you?
I have to say I have two documents. I think one is a dashboard and one are some appropriation numbers. Maybe it was attached. I didn't see the agenda, but please carry on. I will do my best to follow along.
All right. So first off, review of staffing and caseloads. What are MCB's FTEs relative to those contemplated in the final 2022 budget? And if they are sufficient to provide the services budgeted in that budget, and if you could please address by count, by account.
Yes, and that's to me, Joe.
I'm sorry?
To me, you want me to go?
Yes, sir.
Okay, all right. First, if I might, Howard, welcome. Thank you. I think you're fantastic, and I know you're going to build value for our community. So thank you for your service. So regarding the staffing and caseloads, we had met this week, myself and John and Camilla Drogos, who is our HR liaison and chief of staff. So I have some notes here. So I think it's probably, we saw the agenda, and so we wrote the following in response to the agenda. So MCB's FY22 full-time employee cap, so our FTE cap that we've talked about at length previously, is 133.5 FTEs. So the agency's current FTE level is 129.8 FTE. We do have several positions in the hiring process, though, which will bring our agency to meet and or exceed the FTE cap. I say that because there's always, like, we're in process on so many things that it could slightly change. The services provided in the final budget are addressed by and fit within the scope of our FTEs. And to date, the agency has, and I can give you a breakdown if you'd like. So that's 10 FTE in our Turning 22 account. That's the Deaf Blind Extended Supports account, which, if you're interested in the line item number, is 4110-2000. Here we include a newly hired DBES counselor in our Western region, who's turned out to be a great hire. The next category is 71.5 full-time employees in our social rehabilitation accounts. So this includes 7 FTE in our admin and operations account. Again, if you're interested in the line item, that's 4110-0001. We then have 64.5 FTE in our community services account, which includes a newly hired ADA specialist in our assistive technology unit. There was a COVID departure that a departure that we had during COVID times, and so we've rehired for that person. That person has started, which is going to be a help. If you're interested, that account number is 4110-1000. There's also 4 positions in process in community services, which are 2 certified orientation and mobility specialists, one of which we're recruiting from, I think, as far away as California. 1 ADA specialist who will be a regional clerk in our Southeast region, and then 1 registration specialist in the central registry, and they'll be working on, I think they'll be an accountant, but they're going to be working on data, and they'll also be working on some of the consumer services stuff too, so helping that process there. The next is in our federal accounts. There's about 48.3 FTEs. This includes 4 full-time employees in the previously mentioned 4110 account, but specifically our older independent blind grant account, which that account number is 3026 if you're interested. So that's for 1 older independent blind social rehabilitation counselor. They're in the hiring process, and we specifically have them slated to help cover the western and central regions of the state. The next is to equal the 48.3, we have two breakouts. One is the 4 that I just mentioned. The larger one is the 44.3 FTEs that are in account 4110 3021, which is the account that contains our regional director. So that's our regional director of Western Mass. As you know from the previous meeting, our previous director there, Nathan Scrocky, has moved into our central registry team to run that. So that position is out right now to be filled. So that process has just begun. Matter of fact, I think we're just only beginning now. So that's pretty much it for FTE counts. I mean, I don't know if you want any more detail there.
Yeah, that is helpful. This is Amy, by the way, sorry. That's helpful. I think well, first of all, I want to say kudos to Nate. He's been a terrific addition to the registration process. He's always so responsive, so I greatly appreciate what he's doing. I continue to get many people calling us at MABV because they are having difficulty. Their workers cannot get back to them in a timely fashion, and that have not been contacted by workers, or cases being reopened have been delayed. And so we asked the Union 509 to come and talk with us about the FTE situation from their perspective. So I'd like to ask our union reps who have given up their lunch hour to do this to please comment on your perspective.
Okay, so at this point in time, I want to be observant of the Commonwealth's laws regarding collective bargaining. So I'm going to stay here, but I'm going to turn off my camera and my audio, not participate.
Okay.
Jim,
Hi.
do you want to go? Or
Yeah,
Jim?
I'm gonna.
Okay,
I'll
go
start,
ahead.
and I just wanted to thank you all. Carolyn, unfortunately, is also not feeling well, so she's here, suffering through some a voice and throat kind of issues. So I may do a lot of the discussion, but I'm Jim Badger. I'm a rehabilitation teacher in Region 6, the Greater Boston region, and I am a member of the chapter board at MCB of the SEIU 509 local, and I'm the chair of the Disability Rights Committee of SEIU 509. And as I always say, I've been a consumer of MCB for over 50 years, so I'm really glad to be here. I've been a consumer since August of 1970. So Carolyn, do you want to start?
Sure. As Jim said, I have strep throat, so I apologize and do the best I can do. I've been collaborating with Jim and others active in the union. I'm Carolyn Jelty. I work for MCB, been with MCB since 2015. I'm a vocational rehab counselor. I also am the chapter president representing for 509, our chapter, which encompasses the Commission for the Blind, Commission for the Deaf and Hard of Hearing, and the Department of Industrial Accidents. So I'm here just to speak a little bit. I think Jim's going to do most of the talking. And Jim, do you want me to speak
Yeah, if you
to the
could, that would
numbers
be great.
now? Okay.
Yeah, that would be great.
So understanding that numbers are sort of can be in flux, looking at different people's caseloads, particularly certain job titles, such as rehab teaching and mobility, for example, where your caseload can go up and down a little more frequently than a case manager. That being said, we, per our contract and per our agreement with the Commonwealth, our employer, each title has a certain number of people that are supposed to be on our caseload. And that, of course, extends to how effective we can be in our jobs, depending on the numbers that we are carrying on those. Just pulling two very quick examples of rehab teaching and our social workers, both of which are supposed to carry 70 on their caseload. I'm going to pull out just some numbers, which again is just a snapshot of where people are right now as it stands in actually across all regions, but I'll speak to two in particular. In our Northeast region, we're looking at the rehab teachers carrying about a little under 100 right now, and looking at the social workers in excess of that 70 as well, one of which is over 100, one of which right about at 100. Looking at another region, we have our SR workers carrying over 125 each, and our rehab teaching at about 90. So again, I'm keeping this brief just because it's hard for me to talk. I'll bring it back to Jim. But the numbers are in excess and consistently in excess of what they should be per the contract. And I do understand, I want to recognize and acknowledge that we have been working with the executive team and with the commissioner and others to try and figure out how we do better and how we get the people hired who need to be hired. It's of course a process, and I understand there's also the limitation of what the FTE cap is, but excuse me, knowing that doesn't take away from the fact that we have workers who are in excess on their caseloads and therefore can maybe not be as quick and efficient and timely as they would like to be. And of course, we never want to see consumers have to wait longer for services or long at all. So that being said, I think Jim has a little more to add, but I'm going to leave it at that before my voice gets
I'd like to
out.
ask a
Thanks.
quick question
Sure.
if I could, and it would be for both Carol and Jim and the commission, that the budget was increased this year really for an earmark, and then for the carryover of some unspent funds last year because the funds weren't spent due to COVID. Were the FTEs increased to recognize the increased funding?
I don't know who.
I don't know the
wants-
answer to the question.
So I'll just say this, though. It's my understanding that the FTE cap, if we have a certain FTE cap and then those position goes away, you know, somebody retires, somebody leaves, and that position doesn't get filled, that cap is not going to increase. It's going to either stay what it's at or it's going to lower, because when they do the budget and look at things, they're going to say, oh, well, you didn't need that position because it wasn't filled. So I think over the years, we've lost a lot of positions just through attrition. And that's what we're looking at now, and trying to play catch up and trying to get people to come in and want to work for us, but we're already far behind in some areas, if that makes sense.
I mean, that'll be a question for David when he comes back on.
Yeah.
All right, Jim?
Yeah, and just for some perspective on it, we asked the agency around the end of 2020 to give us a list of how many employees have been lost. We could only ask about those that have been lost through attrition or whatever, but who are members of our union. And that number from 2016 to 2020 was 19 employees. And so, so what this all means is
Again, Jim, from when
go
to
ahead.
when?
2016 to 2020, so 5 years, like if you count each of those years as a year. And so what that means is, you know, when you think about an agency that right now only has 129 employees and has a cap of, I think it was 134, I think is what the commissioner said. It's a lot of people, and we were sort of running at max as it was at the time. And so, you know, I think the issue, what it means on a day-to-day basis for us, and I can speak best to the RTs, to the rehabilitation teachers, because that's what I do, is that what, as Carolyn said, the reason we have agreements, and most of the agencies have agreements with our union and the other unions about how many people should be assigned to each person, partly so that we're not overworked, obviously, but it's more so that people will get services in a timely way and that they'll get the kinds of services they need. So for RTs, I can certainly speak to my experience that a lot of the time, even before COVID, we were in a position where we would be getting a lot of new referrals that we needed to see in a timely way. And at the same time, we had people that we needed to go back and see, and particularly because our jobs have changed, that over the years, because technology has become so much more a part of the lives of blind consumers, which has been a blessing to us all. I'm the first to speak to that. Those kinds of things, in order to teach someone how to use an iPhone with VoiceOver, for example, or even to use an Alexa device, which we started providing to consumers a few years ago, it requires going back with frequency. It's not the kind of thing you can do, you know, every 4 or 5 weeks. It really requires going back weekly in a lot of cases, in most cases. And so when you add those things together, and with the reduction in the amount of staff we have, and not a reduction in consumers, what it means is that, at least how I always feel, is I need to see these new people. I'm getting new referrals, but at the same time, I've got to go back and see these other people, or else they're not going to learn what they need to learn and what I was starting to teach them. And I'll start getting phone calls saying, "Why, Jim, have you forgotten me?" And so it's very hard. And I feel like because of that, it's difficult for us to provide the service in the way we would like to provide it, and that needs to be provided. COVID certainly has added to this, and that part is outside of our control and outside the agency's control. It meant that for a year and a half, we were working completely remotely and reinventing our whole model of providing rehabilitation services remotely. And I'm very proud of the work that we've done to do that. We really have done our best, but what that created was a pent-up demand when we got done, when we started going on the road again. There were a lot of people who wanted to see us or needed to see us, where what we were able to do remotely was only partially able to be done. And with some people, barely at all, because they just couldn't follow what we were trying to teach online. And so, and because it was COVID, we also were seeing less people per day because for a number of different reasons related to visiting people. And since we've had the Omicron variant, that was this huge surge, which thankfully seems to be coming down quite a bit, although it's still pretty high in Massachusetts. We've also had a lot of consumers who didn't want to be seen in person. We had people who, and then there were staff people who, because of immunocompromised conditions or families with immunocompromised conditions, weren't able to go on the road again. And so that has been kind of a perfect storm. But in the end, even if we had been working in person, and in our view, we do not have enough staff to see people in a timely manner and to do the services as they need to be done. And the reason we're focusing on this caseload standard is because it's an objective measure of, this is how many people each person is supposed to see. for a reason. That's how it was designed. And yet we're most of us are significantly above the caseload standard. And so, as Carolyn said, we have been trying to work with within the agency. We've spoken with the Secretary of Health and Human Services. We are going to be filing a class action grievance that regarding the caseload sizes, because it's another way of dealing with it. It's not something that we did lightly. We, you know, it's just more work to do on top of everything else. But we really do need to solve this. And I think, you know, there is a place where whatever the cap happens to be right now, as Carolyn said, a lot of that is because the staff has diminished because we have not replaced people. So the administration and finance people then say, well, I guess you don't need those people. It's just like budget money you don't spend. We need to work together in some way to get the cap raised and raised significantly enough to rebuild the staffing at least to where it was 5 years ago. And so that's what we're trying to do in whatever way we can.
Okay. That's helpful. Thanks, both of you. I just have one additional question since you're here. So I know the last couple of months there have been some efforts made to try to get appropriate PPE for workers, which could help with safety for consumers and employees. Has that situation been resolved?
It's in process.
Okay.
So far, all staff have our cloth masks and paper masks, which really, from what the CDC is saying, is not adequate to keep people safe or to keep staff safe or consumers. We did push for and have been granted that we will receive fitted N95 masks, at least for the close-facing RTs, O&M people, you know, that are working long periods of time, very close. When you're teaching someone how to use an iPhone, you're right next to the person for 2 hours, hand over hand, breathing the same air. My understanding, maybe the commissioner would know, my understanding is that there's a contract being signed to get us fit tested. This is, we hadn't heard anything for a long time. We had gotten that agreement with the Secretary of Health and Human Services at the end of December. What it's meant for some people who are immunocompromised or whatever is they haven't been able to go on the road during the surge. And I have to say, the agency has been quite flexible and, you know, has worked with people to try to keep us safe in that way. But I can say, as somebody who's in that position, we're really cooped up and we would really like to be out there seeing people, and we really need to be. And that working with people remotely then takes me 2 hours to do something I could do in 20 minutes in person. So we're kind of in that's where it stands right now. And I don't know, the other pieces, the other workers, social workers, people who are not the really close-facing people, but they are oftentimes, but they weren't identified as specialized professions. They're still, there seems to be an effort to get them to be able, because they do some RT work and some O&M work, to be able to get them higher grade masks. But that's our stance really, is that everybody needs to have at least KN95 or N95 masks to keep everybody safe.
Great.
And we have been working with the agency on that, and we're just, like Jim said, working to get everybody the best, most substantial protection that we can.
Sure. Understood. I appreciate both of you coming on today and lending your valuable perspective to the situation. So thank you.
Well, thank you for having us.
Thanks.
I mean, I had a quick question for everyone, and it would include the commission, that Jim referred to remote work being less efficient than in person. If it's less efficient, then that's likely adding to the caseload, right? And I would hope that as Omicron goes the other way, that you return to normalcy being on the field, at least that should mitigate some of the caseload. I clearly understand the issue if you've lost FTEs, but you haven't lost consumers. That's an issue. So.
That's right. I mean, it has what it means is the work is more labor intensive, and it's different. I mean, for an RT, it's a lot more labor intensive because what we do is a lot more, hands-on, so to speak, if you're doing it remotely, than if you're a social worker. It still makes their work a lot more complicated. But when you're doing more case management or counseling on the phone, that's a little bit less labor intensive in that way. But still, we were already over caseload standards and struggling before COVID. It's just that COVID has turned it into a really perfect storm.
Okay.
Yeah, if I may really quickly, this isn't new, that the caseload standards have been exceeded, which is at least in part why this agreement even came into place for our last contract. We're just trying to play catch up and make sure that we're actually remedying it, but it's been in the works for some time.
Okay.
Okay. If there's nothing else there, we'd ask MCB to review the dashboards, and that would be tracking MCB performance. That's not the financial dashboards. That is the headcount, registrations, and so forth. So, David, back to you.
Okay, so if we're complete with that portion, I do just want to be sure to say, though, that MCB or I don't want to be construed as engaging or be engaging in collective bargaining within the context of a SAB meeting. Like, our staff has rights to collectively bargain. I respect that. And the taxpayers have rights as well, and I respect that. So that's why, just for the public, I turned off my camera and audio, and I don't want that to be construed in any way as deliberations or, back and forth.
Yeah, understood.
Understood.
Yeah, so,
Totally understood.
yep. So, Nate, are you here to discuss the dashboard? We put the dashboard. We worked with Luis and Nate.
I'm here.
Yes, thank you. To put the dashboard together, we had sent that out to the group. And Nate, do you want to take everybody through it?
Sure. I can share my screen. Hold on.
Thank you. Oh, Regina, yep. Can you let Nate share? Thank you.
All right. Can everybody see the dashboard? Is it up?
Yes.
All right.
Yes, thank you.
So we'll start off with registrations. We've done 149 registrations year to date. So that's about 6 weeks worth of registrations. We've processed 149 people from the registration list into our system. The next section, registrations current inventory. I'm going to walk you through this really quick because this is new and this is what was requested about asking what the backlog of registrations currently look like. Under quality control, so these are, and is everybody familiar how it works, or should I explain how the registration process works? Do you think that will be helpful?
Yes,
Why don't you
please.
explain it
Thank
for
you.
everybody, particularly
Yeah.
with Dr. Purcell being his first meeting?
Great. So the way it works is registrations can come in a number of different ways. They can come in either through our portal or on the web. They can come through on fax, mail, email, and we'll receive any of those. And if it comes through the portal on the web, it comes into our system that we manage it. And the first step of that system is to QC and to go through and make sure that we have everything we need to register that person. So the different buckets are the quality control is our registrations that have come in through the web. Fax, mail, and email are registrations that have come in for any of those items. So, we get a fax, we get something by snail mail, or, something comes through as an email. that also has to be inputted into the system. So we actually data input that into the system at that point. Once it's quality controlled, it goes into what we call a central registration bucket. And that means that that registration is ready to be inputted into our case management system. So right now we currently have 96 that are waiting to be QC'd. And that number really is 126 because that includes the fax, mail, and email number. And as those get QC'd, they move into the central registration bucket to be data entered into the case management system. The needs verification number, is, which is 30 here, are cases that have been quality controlled and it was determined that there is missing information. So that's when we would reach out to the eye care provider or to whoever we need to get that information to process through that particular registration.
Hey,
So
quick question. What kind of missing information would there be?
It could be missing a birthday. It could be missing the actual diagnosis on some of them. Go ahead, David.
Yes, thank you, if I might. So Joe and everybody, that's largely dependent upon the mode with which we get the information. And actually, one of the reasons we chose to go electronic. If you get it in via the old school fax, a lot of the times it's deciphering the doctor. Sorry, Dr. Purcell. It's deciphering the doctor's writing, right? So I think it depends upon the mode. In the new system, that is greatly, greatly improved. Like, for example, we have required fields where you can't even submit the record unless the address is filled out and all the information is filled out appropriately. So a lot has to do with the mode. And then occasionally it will be redundancy. I'll give you an example. Mr. Sullivan, Michael Sullivan. There's a lot of people in the Commonwealth named Michael Sullivan, right? So sometimes we'll get Michael Sullivans in the same city or town, and we're doing the quality control to assure it's the right Michael Sullivan.
So, so the issue surrounding a diagnosis, I mean, that when you get, so I would assume if something's filed electronically, all of that stuff is in there generally?
Yeah, it's required fields, so it's in there.
So they can't push the button. But if it's a fax, whoever is, and maybe it's you, Nate, would you pick up the phone and call the provider to say, look, I'm missing Mr. Sullivan's birth date or the diagnosis? That's
Absolutely.
sort of one. And then the second thing is, I assume that if it's something insignificant missing, that you let it go in.
Yeah, absolutely. If it's something that's not going to be needed to register the case, of course, we would put it in and get that information afterwards. But yeah, it is picking up the phone. If we don't get a response, it's following up with an email to make sure that we have, that correspondence as well. Some people respond better to phone, some people respond better to email. We usually do both. And it's just, and sometimes it's following back up. A lot of the eye care providers are busy. So, we need to remind them and follow up and get these in as quickly as possible.
And Nate, this is Susan. I just wanted to be clear on a couple things. So
Sure.
The 149 are completed registrations where you've got the 2022 year to date.
Yep, those are ones that have been into the system.
Yeah.
Yep.
And then the 210 column that you've got, when you say central registration, those 79, are they done? They're registered or they're in process?
Nope, those are the ones that need to be data entered into the case management system.
Okay, and then the quality control, when you've got the 30 in fax, mail, email, 30 need verification, are they also in quality control or?
So yeah, the fax, mail, and email are need to be QC. They need to actually be put into quality control. So the way it works, if we get a fax, mail, or email, we have to input it into the system, and it goes into as a fax. It's called fax in the system, and then from there, we have to verify some of the information on the actual fax, which can be difficult because of, like David was talking about, handwriting and those type of things, and that moves it into the quality control bucket. And then from there, once it's QC'd, which those when it goes from the fax to the QC, it's a pretty quick process because we're not QCing it twice. We've already really QC'd it. It's just a process piece at that
Yeah.
point. That's why I kind of said they're the same. And that will, those
Sure.
usually move right into the central reg to be inputted into the system. So it's a multi-step thing, and I'll explain in a couple minutes a few things we're doing to improve that process and to make it quicker on our end, and we're very close to that right now. But so as you can see right now, we have.
Well,
I
I do have a follow-up question to that, if you don't mind. Sorry to cut you off there.
No, that's okay.
This is really great. Thanks for taking a stab at you know, from our last meeting where we raised the question and asked you to come back with the plan. So I really appreciate that. I guess one of the conversations last time was that it appeared that the days between someone registering and someone getting complete registry was getting longer, or that was the suggestion that some people were observing that. So I'm wondering, is that something you're able to do, how long it's taking, or is that not really data you have access to?
It's data I do have access to, and I can speak to that a little bit. So when we talked last month, you know, after the conversation, I went back and looked at the data, and we had cases that were in the system as old as, you know, sometime in October. So that, you know, maybe 2.5 months behind, because we were in January at that point. Right now, as we sit, we don't have anything that's, I think, older than 6 weeks that's been in the system, and we continue to improve that. And we've put a number of steps into place to monitor that and make sure that when we process cases, we're processing from the oldest to the newest. So there's nothing that's getting skipped or nothing that we're moving forward. We're going right from the end of the line to the front of the line. And over the last month, you know, we went from being almost 2.5 months worth of backup to, or for time wise, to, you know, less than 6 weeks right now. And I expect that number will improve greatly by the time we talk next month.
One quick one, and I'm glad you're working down the backlog. We had talked about for registrations in the calendar year, going back to 19 and showing those as comparative. And if you could do that going forward, that'd be good. But I recollect that 2019 was a fairly big number. 2020 was down because obviously people weren't going to their eye doctors to get diagnosed. And I sort of half expected that the 2021 number, both because of pent up demand and then because of the media campaign that the commission's done, the 2021 and then 2022 year to date would have been bust out numbers, sort of recovering what had been lost and then some. Do you have a view on that, Nate?
David, do you have a view on that?
Yeah, I mean, my view is that we're still in a pandemic, and the general, I think, attitude of the community is somewhat hesitant. So as COVID subsides more and more, it probably will go back to those numbers and will probably exceed those numbers, because anecdotally, I think the profile of the consumer, or the inbound, the prospective consumer, if you will, is slightly different. So I think we'll see it go back, but it's still impacted by COVID, in my opinion. But again, a lot of that is anecdotal. I mean, we'd have to do a huge analysis and go into Aware and everything else to really, you know, figure it out. But that's my gut feeling.
Well, based on these numbers, it looks like a major increase.
Yeah, I think the increase we're seeing right now, though, is also a little bit because there was a bit of a backlog, and we're really pushing through it. So I think they might be inflated in that aspect a little bit. One of the things I am doing that I started a few weeks ago, is because I just thought it would be helpful for us as a group, is we're keeping track of the stats daily. So we're seeing how many cases are going out and how many cases are coming in on a daily basis. So maybe after a few months of gathering that data, I might be able to speak a little bit further to about forecasting numbers for the year and looking at historical data comparably, and we can have that conversation. But I think I would be more comfortable having that conversation after getting a few more months of data.
All right, that'd be good. And again,
Yeah.
having 2019 data in there is important because from that, I can't tell whether 2021 is a huge increase, a moderate, you know what I mean?
Yeah.
Yeah, you need the visual. Okay.
Nate, this is Amy,
Hi,
and
Amy.
thank you. Hi, how are you?
Good.
Thanks so much. Now I have a question because I have a particular consumer, and I've asked that her MAVI worker get the number for the doctor who submitted this. They say
Yep.
they've submitted it numbers of times. When obviously you're not always in the office. So when you get faxes, when the agency gets faxes in, how does that data get communicated to the people in the registration office, the registration department? Sorry.
Yeah, there's a fax bucket. We're not in the office individually every day, but someone
Right.
usually is.
Okay.
So someone from the
And just a
team is in the
clarification,
office.
Nate, she may be unaware. Amy,
Yeah.
so when we say faxes, those come in two different varieties. One, off an old school fax machine.
Right.
Two, and the larger group is by e-fax. So you don't need to be in the office. Those come electronically, almost like
Right.
an email.
Right.
Yeah.
I do understand that. Thank you.
Yeah, so right now we shouldn't be missing really anything at this point because we have office coverage where someone's usually in the office in Boston picking up those actual faxes. And then when we
Okay.
do pick up those faxes, that's when we do input it into the system. And that's that bucket, that fax mail email bucket that we
Got
have
it.
on the dashboard.
Got it. Thank you.
You're welcome.
Howard, I'm not sure what the exact protocol is to speak, so I'll just jump in real quick, see if I can add something that might be of some value here. One, I was listening to the conversation about sort of how the volume at the doctor's offices are looking and how that may be impacting on your numbers. I will tell you probably for the past 3 months, and we have clinics all over the city, all over the state. So this would be community health centers, VA hospitals, and our own clinics. Probably for the past 3 months, we've seen a return to normal volume. So my expectation would be there'll be a little delay between that and when perhaps you'll start to see the numbers. But if our, it's pretty broad, but it's only one, measuring point, you should start to see those numbers returning back based on doctor referrals. I have to say one thing that surprises me, and maybe I'm wrong, Nate, you can help me. When you talk about the fax stuff, are these faxes coming from doctors' offices?
Sometimes, yes. Yep.
It's shocking a bit to me, honestly. I think you could at some point say to the doctor's offices, we no longer accept faxes and you will be just fine. I don't think that will create any problem. Well, I could be wrong, but I'm just saying most of the engagements we have in doctors' practices, because in many ways, we can't use fax for certain things. People are moving away from that. So I don't think you'd see a huge reaction. It might make things a little easier from your end. So my 2 cents.
Yeah, we encourage people to do it online for sure. We're hesitant to say we're not going to take fax because we want to be accessible to, and there is some smaller practices that are still more comfortable with the fax, and we do try to educate them, and we have dialogues back and forth to try to educate them on the best ways to do it and what's easiest and most time efficient and those type of things. And we'll go out and sit with them if need be. To go through the process. And I think we've been pretty successful in really getting people to use the online system. But
what do we have now, Nate? It's about 75-25. 75 coming in electronically, 25 coming in other means, right?
Yeah, I think that's safe to say. And it's and it continues to improve as we, as people get more comfortable with the online piece. I've gotten phone calls saying that, it's just so different, this, that, and the other thing. And you're asking for, no, it's like, no, we're asking, it's literally the same information. There's nothing that's different. And, sometimes it's just them going through it once and kind of being comfortable with it. And if that takes us going out there and sit with them to do it, that's what we'll do.
Who's been super helpful, Howard, and not to throw roses, but of course, Nicole and Lexi. They were in our eye care provide. Dr. Nicole Ross is a great low vision doctor, and is she a associate professor or she's a full blown professor?
She is an associate professor with full tenure
at New England College of Optometry, and her colleague Lexi Malkin. Both of them have been terrific. They were key contributors to last was it Carla, was it the summer or the spring that we did a huge eye care provider event and we offered continuing education credit units. So it was a big event. I want to say we had hundreds of doctors on that training. That was a huge thing. So as Nate indicated, the adoption continues to be better. What we're seeing is these outliers are the small kind of 1 or 2 person shops of, either an optometrist or an ophthalmologist that's semi-retired who only comes in a couple of times a week or something. Those are really the ones that are still doing the fax or the other things. Pretty much all of the major clinics, Nate, right, are using the system exclusively. One of the challenges we faced with them on the other side is because, like, I just went to see Carolyn Baumel the other day for myself, for example, between her and Dr. Duker, they see, and all the residents there, they see about 200 people a day in their clinic. Mass Eye and Ear is about the same. They probably, when they do clinic, they see probably. So what happens is the administrative people working with them and the nurses working with them, there's a natural lag on their end too. So we're facing gluts of processing. They too are facing gluts of entering into the system and everything else, because a lot of the times they have to check back and forth with the doctor, or let me look at these images or these pictures or this chart or whatever. So I think it's getting better. I think the modernization has helped greatly with the fidelity of the information and the speed of the information. Quite frankly, some of the quote unquote backlog, for lack of a better term, that we face is a result of a system was built with a certain flow to it, relying on paper process, relying on fax that had a certain flow and time with it. Now everything's instantaneous. So we can be caught up in one day and there can be a big clinic day and all of a sudden we get 50 in the system in one, in 5 minutes, click, here's 50 more. So part of that is us getting used to the system ourselves. We're waiting for our 2 developers to work together to make our systems talk to each other. So right now we use Konica Minolta Business Systems for this tool that we're talking about right now for the registrations called OnBase. Okay, the MCB registration system is run by a database, a cloud-based system called OnBase. We're trying to get OnBase to talk with Aware, which is put out by Alliance Software. Aware is our client management system. That's where all the consumers' case files sit on. We've engaged them and we're giving them orientation and mobility. We're giving them assistive technology, whatever the case, when we open up a case with somebody. So we're currently, we have to do that transfer manually. We're in the final stages of automating that process, which Nate, maybe you want to indicate how much better that will be.
It's going to save us 30 to 45 minutes a case if that gets automated, because it takes about 30 or 45 minutes after we QC it in the registration system and to input it into Aware is taking 30 to 45 minutes to physically input it, data enter it. If we can do it automatic, it's just going to be going it back into Central Red or the Aware system and really just QCing that the data went over properly. So we're talking from 30 minutes to 45 minutes to about 2.5 minutes to 3 minutes. So it's a huge saving in time. And actually, just an update on that, Commissioner, as well. They're meeting right now. We've been going back and forth at this final stage trying to get it right. And we kind of just said, let's all get in the same room. And as we are speaking here, they're all speaking together to try to.
So Luis has Kathy and then Alliance on?
It's Kevin and that crew, the IT crew with Alliance.
Good.
Yep.
Good. And one of the wrinkles to that, just by the way, Alliance is based in Washington State, so they're 3 hours behind. So that adds,
it's hard to coordinate. Yes.
Yeah. So,
yeah. Nate, this is Susan. That's great to hear that you expect that to be much easier and much efficient. Do you figure this dashboard, the way you've designed it, will capture that over time? We'll start to see that. Is there anything else that you want to change in the data that you're collecting to just document how efficient that's getting or how quickly you're getting to registrations?
Yeah, I think this should show it because you should just see the numbers drop or hopefully eventually just fall off. Once we get caught up and get into a system where we have like a regular, expectation, whatever that we decide that is, it's going to be 10 days or 2 weeks or whatever it is for us to process a registration. You should just see whatever we have in that time period on this dashboard and nothing more. I can show you real quick just what I use as a kind of a daily thing. Can everybody see this, the Excel spreadsheet that I changed over?
Yes.
So this is kind of a daily with the same numbers, but what I have added here is the cases in each day and the cases out and kind of what our progress is. So some days we get more cases than we're able to process for a number of different reasons because we're moving cases from one queue to another or other things. But you can see where, over the past 5 days, we've made a progress of 37 cases against the backlog. So that's what I'm using to kind of monitor myself from a day-to-day basis and to make sure that we're obtaining the goals that we're setting. But I think what we have here in the dashboard will show that sufficiently, and I can speak to it from month to month as well.
Terrific.
And Nate, thank you for stating those numbers for those of us who cannot see your screen. So thank you.
You're welcome. All right. Do we want to move on from the registration? Does anybody else have any other questions? Okay, so I'm going to just continue to go through these. So here's the SR cases as a total, so we can see the DBES. You saw
The
a
consumers
decrease.
and the public, Nate, SR is social rehabilitation, VR is vocational rehabilitation, DBES is our deaf blind extended support services unit. Sorry, Nate.
Thanks,
I just noticed we have some new public here, so.
Yep, absolutely. So we saw a little bit of a change, a decrease in the SR children. That wasn't a big decrease as an agency. That was, so when I had the numbers for you guys last month, they were run, but I went through and did all the numbers myself for this month and went through the whole process and QC'd our equations and the data and everything else. And that was just a small error in the one of the equations for the data. So that's why you saw the drop there. So these are the accurate numbers here. And that was a little bit inflated last month, but that was a data error. And we saw the same thing here in the vocational rehabilitation cases. So that change for those who cannot see my thing in SR children was 866 down to 788 for a negative discrepancy of 78. But again, we didn't lose 78 kids. That was a data issue. And the same thing here in the VR with the adults. We saw a change go down to 586, but you'll see the 586 more aligns with the number from 831. But again, I think that was just because of equation error for the last two runs. Pre-ets went up 30 and transitional youth went up 8. Again, I think that was data. Closed SR and SRC cases, we have 12 closed children cases currently for the fiscal or for the calendar year, and 208 SR adults closed so far for the first 6 weeks here. And closed VR cases, now this is the federal fiscal year, so this is going back to October until now. We have 40 that were closed so far this federal fiscal year, and we had so those are successful closures, and 27 others for a total of 67. Yes,
Nate, this is Susan again. Just to be clear, some of the SR children might move in that you close might actually move into either VR adults, or they're not necessarily closing to MCB. They might be moving into an adult category.
Good point, Susan. You're absolutely correct. And probably every single one of those, unless they've moved out of the state or have passed, they would have moved into a VR case, like the pre-ex caseload.
Okay, thank you.
Thank you. And then support services for the calendar year. So these are referrals to O&M, RT, or assistive technology. We're currently at 271 for the calendar year for that. So does anybody have any questions or anything else that they would like to hear about or see?
Would you get down to the bottom again, Nate?
Absolutely. Is that good, Joe?
Yeah, that is good. The supports are, well, do you have a comment, or does David have a comment, or John, on 2021? There was some recovery, but the referrals were down from, I'm sorry, the services were down from 2020 and down dramatically from 2019. Is there anything you can cite?
Yeah, I mean, I think a lot of it is COVID and you know, people not being comfortable, so they might need O&M services, but not be comfortable seeing somebody in person yet. You know, it could be same thing with rehabilitation teaching. You know, they might not be having comfortable with people in the homes at this point. And sometimes, like Jim was saying earlier, we can do some things remotely, but there's some things that just people, a lot of clients don't want to do it remotely or don't have the capability to do it remotely. So it could have been waiting to a point, which I think now most of the staff are out in the field and helping where we can. So, I
we
expect numbers to be higher this year.
All right, good. Thank you very much.
You're welcome.
Just one comment I would make here, and we can come back to it another time, but we're doing some interesting research around telehealth and the ability to deliver some services, certainly not all of them, via telehealth. So it's something perhaps if there's interest later at some future time, I could give you a little more detail around it, may be able to assist us in helping to prepare for situations where it may be more difficult to visit people. And in some cases, you can actually do even a better job by being able to see them in their home environment for the doctor as well. So something we can get into more later. It just made me think about it as I looked at some of your numbers.
Great.
Dr. Purcell, use this meeting as an example. I've been involved with government for many years. When I was chair of the Rehabilitation Council, I think there was one meeting out of the several dozen that I attended, one meeting where people from the general public showed up. This meeting, when we used to meet before COVID at 600 Washington, I don't know if any member of the public ever showed up. Just as a comparison, now look at, and it's wonderful how many of the public show up and participate. So that's a great thing. I think telepresence now has opened up avenues that previously weren't opened up. And if we had said to our consumer base and our stakeholders prior to COVID, oh, we're going to have everybody join by Zoom, they would have been like, what? You're doing what? You know what I mean? So I think it's a good thing generally. And I agree with you. I mean, telepresence isn't going away. It's only going to increase.
In this case, we're talking about the ability to do some assessments, et cetera, not just have a conversation. There are tools being developed and some that already exist. So again, if there's more interest in this, I'm happy to come back to it and provide more detail, but something that perhaps Nate, you and I could talk about may be able to help you.
I appreciate it. Thank you, Howard. Yeah, I'd love that. All right. Well, if there's no other questions, I appreciate everybody taking the time to listen to me.
Thank you,
anyone needs follow-up, you know where to get me.
Yeah,
All right,
thanks,
good.
Nate.
Thank
Right,
you,
so-
Nate. That was really informative.
So
And just a
moving
shout
on.
out to the people who work with Nate, Luis Nolasco, Karen Butler, and Cynthia. They do a great job, as well as Susan Lavin, Patricia Hart. Really, you know, we've moved a lot of duties around with different people to help out in that unit to try to you know, cut into it when people have been out for various reasons. So it's a good team effort.
All right, so next is financial and performance dashboards. I did notice, David, on the financial dashboard you sent out, it didn't appear to include the encumbrances.
Yeah, so, all right, hold on. Let me share my screen here. Can you see my screen here?
Yeah, it's popped up.
Okay, so then, hold on, I have a note there. I mean, we've tried to get you everything. So here's what I have for
Oh,
notes.
there it is.
Yeah. And so, hold on, let me write my note here. Services provided under the $850,000 earmark, spending encumbrances and referrals to date. So we have the Carroll Center for the Blind, Massachusetts Association for the Blind and Visually Impaired, the Polar Center for Social and Economic Development, New England Low Vision and Blindness, and Lowell Association for the Blind all received earmarked funding to provide timely services for our community. We're using what you see reflected here on this spreadsheet. We are using MARS data, that's the State Financial Reporting System, encumbrance, since that this is the statewide accounting system info. So that's what is reflected here in column I.
All right, just so you know, that wasn't in the spreadsheet that you sent out yesterday. So this is new information to us.
Okay, I thought it was, maybe I sent the wrong version. I have so many different versions that we've been working on. So that might have been an oversight, but here it is now, and I can audio describe it for everybody. So what we have, and I just got, sorry, I gotta go to that camera. I gotta get close to my screen to be able to see it. So in column A, what we have is that's the state budget line item appropriation number. That's essentially the account number, okay? In column 2, under appropriations, we have the title next to the account number. In column C, what we have is the FY20. This is for context, the FY20 approved budget. And then in column D, we have the FY21, so the fiscal year 21 approved budget with overrides. Then in column E, we have the one we're currently operating, FY22 GAA. And in column F, we have the year-to-date expenditures. And again, as you could, there's an asterisk there, and the note down below is data is as of my birthday, 2/9/22. And if anybody would like any detail, all you have to do is go to see-through, which is the state of Massachusetts, the comptroller's website, where you can get any and all financial information that actually quite exceeds this, depending upon how detailed you want to get. Back to the spreadsheet. In column I, we've added, per your request, the year-to-date encumbrances that are in MARS. Then in column J, what we have is the committed, the year-to-date committed monies with the aforementioned vendors that I indicated. Then in column K, we have what's proposed for next year, the FY23 House 1 budget, the governor's budget. As you will notice, that budget is lower. It is lower substantially and principally because the governor's budget does not include earmarks.
Right.
So if you take that out, you'll see that MCB is very consistently and stably funded. And so those are the columns. Now, and then we'll add them, by the way, if you're on our stakeholder list or you'd like to be added to our stakeholder list to get budget updates, all you have to do is just send us an email or let us know somehow and we can add you. But you'll see that the other columns, N, M, N, O, and Q, will be added as those versions of their budgets come out, meaning the House and the Senate and the conference committee, and then the final and all that.
Right, so
those are the columns, and then the rows are our 001 account, which is the administration, basically. The 1000 account, which essentially is most of the SR services, community services for the blind. Our 2000 account, which essentially is our deaf blind extended supports program, otherwise known as Turning 22. And then our 3010 program, which is our federal account, which you got to realize there's additional federal dollars there that, we fully match. Massachusetts is one of those states that we fully match all of the federal dollars. So these are the state dollar portion of our VR account.
all right, so question on line 6. What is PAC?
Yes, so the PAC money is the money that, as a result, let's just for explanation. So, all right, we were humming along in March of 2020, and the pandemic came upon us and everything shut on Friday the 13th, and at 5 o'clock. We were open for business Monday morning, 9 a.m. We couldn't go into homes like we normally do. We couldn't, the world stopped. I don't have to remind everybody. So as a result, a lot of the dollars that we had programmed and, what we were encumbering and committing and all that, we weren't able to spend because everything closed. All the programs closed. So the amount of leftover money that we had, surplus money, excess money, however you want to say it, money that was unspent, this $874,000 went unspent. That wasn't just for MCB, by the way. All the agencies got together, and the governor got together with the legislature and said, look, we don't want to revert all this money back to the general fund, because when we come out of this, we're going to need to spend that money. So what they've allowed us to do now, Massachusetts, just as another aside, sorry, but I got just to explain it. So the Commonwealth, the corporation that is the Commonwealth, operates on a fiscal year budget that begins on July 1st and ends on June 30th of every year of the following year. Okay. So it's not Jan 1 to December 31st. It's July 1 to June 30th. Okay. So that's the fiscal year cycle. Further, unlike some other states, we have a 1-year budget process. Some states actually have a 2-year budget process, and the federal government actually, for our VR grant, they have a 2-year process, meaning when you get your money, you've got 2 years to spend it. When we get our state money, we have 1 year to spend it. This PAC is a special law that the legislature passed to say, we're going to let you, on this occasion, carry that money forward. So that's what that money is.
All right. It's sort of a long answer. We knew there was money carried over. So as I look at this, and if you could ask Regina to please send this spreadsheet to the SAB, as I said, we did not have columns I and J.
Okay.
So it looks as though it looks as though the assistive technology training earmark has been committed, and you're going to run out of money.
No, I don't think we're going to run out of money. I think we're going to come close to spending all of it.
Well, it says what the spreadsheet says is it's committed. The whole 850 appears to be committed.
All right. So we enter into maximum obligation contracts. Our intent is to spend all of it. We hope to get there. We're not sure of it. This is one of the reasons why we've previously stated, and one of the reasons why I just bemoaned that explanation. General public people looking in here shouldn't be like, well, what do you mean you're not going to spend? Like, that's the whole reason. We're not trying to hide information. We're just trying to not be confusing.
So I thought
our intent is to spend all of it.
I'm a little bit confused then, because I thought an encumbered fund. So you enter into agreements with the Carroll Center, NAPV, and the Polling Center, whoever else, for maximum contracts. My understanding is those funds aren't encumbered. The only time a fund becomes encumbered is when there is an issuance of a purchase order. So where it says year-to-date Mars encumbrances, it says 795, 780. What that suggests out of what I understand the definition to be, POs have been issued for 795, 780.
No, I don't think that's correct. I think so in our budget process, we have certain exercises that we need to do. One, we're engaged in right now, as a matter of fact, called mid-year spending. During those exercises, we need to see if we're hitting our targets. So again, that's why you're getting to see here what we're doing in these exercises. So I mean, really, I don't know. This is everything. I don't know what else. There's really nothing else. This is
no, but I think that we're missing one another. Is that I had always understood an encumbrance to be a PO has been cut. Is that right or wrong?
I don't understand that terminology. I mean, John, are you there? I know. Look at John. John, what a public service. John is at like his doctor's visit here. I think he's joined. John, are you able to join?
My video was turned off. I can't turn it back on. So
no, that's okay. We can hear your answer. John knows these programs very well and encumbrances and the MM and the EE and all accounting. Go ahead, John. Why don't you tell him?
The encumbrance you're looking at is a Mars encumbrance, and that's a contractual encumbrance.
We can't hear you, John.
All right, I think we lost John. I think he said it was a contract. Oh, go ahead, John. You're back.
So that's a Mars encumbrance you're looking at, and that's what's on the contract. And the contract is for that amount that it shows there. That's for the vendors.
I'm sorry, repeat that, John. I didn't quite get that.
What you're looking at is obligations in Mars. And that's the obligation for the contract. Those amounts of money are to those vendors on the contract.
Right, but I had understood all along, something is encumbered when a PO is cut.
So there's two types of that. What you're getting there is Mars. The encumbrance you're describing is a checkbook encumbrance or is an OI encumbrance.
Yeah, I mean, I know, but I think what we've been talking about is what has been committed to. A contract isn't a commitment. It's just a maximum amount. And what we've talked about is spending plus the POs. That's what I've always understood is what is encumbered. Now, I'm not sure, I don't even know what Mars is, but in simple way.
It's the state fiscal accounting system. That's how everything gets paid out to the vendors.
John, you're breaking up. I can't really hear you.
The state Mars, MMRs stands for, it's an acronym for like Massachusetts Management something system or whatever. It's the state books. It's a state accounting system.
Yeah. But what we had asked for last time, and I don't want to belabor this, is what have, because we spoke about this at length at the last meeting, was the POs that had been cut.
Yeah.
So that's what's of interest. We already know you have contracts outstanding for services, which you may or may not spend.
This is the aggregate amount.
It includes contracts which you may or may not spend, right?
No, that's it. That's in J.
What I'm talking about is I. The 795, 780 represents POs and contract obligations outstanding. I'll tell you what we'll do, because we're kind of going in circles here.
Yeah.
We'll put something in writing to you, just so we all understand the specific request. Amy, did you have something?
F and I
No,
equals J.
I was going to suggest that exact thing so we could continue to move forward.
So that we can continue to move on, okay? So with respect to the assistive technology in independent living, earmark, I know that you have an informational session next week. The PO, is the PO situation been straightened out?
I don't know what you mean by that.
Well, you were implementing the new PO system. It was a little clunky getting POs out. It's what you said at the last meeting.
I don't remember saying clunky, but matter of fact, I think the rollout's been excellent, actually. So yes, we do have a new electronic. We've modernized, just as we modernized the central registry, we've modernized our fiscal system. So we have a new, formerly paper, now electronic agency purchase order. That's what APO stands for. APO is agency purchase. We do have a new electronic system on that. The rollout's actually been very smooth. The adoption rate has been high amongst the vendors, amongst the staff inputting, and amongst even consumers that have to do get reimbursements and stuff like that. So it's a big success.
Yeah, David, this is Amy. I noticed there, understandably, there was quite a lag. We didn't get very many in January. The one question I have, and I'm trying to get the time to look into this more carefully, but the APOs that are coming through now, unlike the ones that you had with the previous system, are not fully accessible. I have tried maximizing. I've tried, unless there's something I'm missing, but I'm opening them with Acrobat Reader, as I would expect to.
Okay.
And there's
We've
important.
worked very hard to make it accessible. So please let us know your specific things, and we can get you.
Yeah, I'm not seeing consumer name. I'm not seeing the consumer name, and I'm not seeing the specific service. So what I have to do when I get a PO is I have to use some kind of a service to get it read to me, because I can't read it. I don't know if you've had any totally blind people using a screen reader.
Yes, quite many actually. We tried it out with. So
and in terms of receiving the POs as well.
Yes. So
okay.
let us there. We did put out a training. We can get you that link, and if not, we can get you more individualized training.
Okay, no, if you can just tell me where to go to look at that, I'm happy to do it. Again, I just found that it's not been, unlike the previous, that I was receiving, I'm not finding some of the most important information that I need.
Okay.
And again, if it's my system, I'm happy to, change something.
Yeah, we'll work through it. I mean, the reason why we selected the system was because it was accessible.
Yeah.
We spent a great amount of time on making it even more accessible, and
well, that's why I was surprised about it. Yeah. Okay. Thank you.
Yes, I'll let Evan know. I'll let Evan Silver know.
Okay.
And Chandra.
Okay.
All right, a commentary on the House 2 budget. Now, I thought I had sent an email Monday and I never hit send, but I did have some specific questions on it. The first question is, when does the next budget version, is that expected to come out?
Yep, so we being the administration, the governor has offered his budget. And you saw that reflected in the spreadsheet. On Tuesday, I'm scheduled to provide testimony to the legislature regarding MCB's budget. So the House budget process is underway. They will give their budget recommendation. Then following that, the Senate will come out with theirs. Then it'll go to Congress.
I understand that. When is the next version scheduled to come out?
We'd have to find out from the legislature. My guess is it will be sometime soon.
Okay. All right. So there were some questions. I can go over them with you and we can delve into it in more detail. That in the administrative account, 111, there's a projected increase in spending of 553,000. What's that for?
Good question. Let me see. 111. Just reading through my notes here. Okay. So operating expenses over FY22, projected spending of 553,700 in account 001. This is because we are shifting the rent cost back to this historical account where it used to be. This new funding level is in line with where it was in the past. As you know, there are small yearly increases to the rent that have been included. That's the note I have there.
What rent is that?
I believe it's the main rent at 600 Washington Street. Because we're not paying rent at the touchdown spaces. And then it's a state office building out in Springfield, so that's a different.
Yeah, I mean, but if I look if I look at the history, Dave, that the House 2 budget is 679, 792. The rent is running the 300 to 350 range. So I think for the next time, and I think the SAB is going to request that with respect to both the financial results and the budget, that Chandra attend, so that with questions ahead of time, so that we
Once again, as I've indicated previously, Ms. Gardiner will not be able to attend. If you give us a specific question, we can work on it in advance.
And why can't Ms. Gardner attend?
There are some personnel related issues there that she's not going to be able to attend. That are confidential in nature. That's, as I've indicated to you privately as well. So, I mean, so you keep putting it on the agenda. I'm going to keep giving you the same answers. You can't attend.
Well, you've never said that.
Okay. Yes, I have. We can check the tape, but that's fine.
Okay.
And I've indicated that to you privately and Chris numerous times. Just as an aside, I find Ms. Gardner extraordinarily competent. She's one of our best employees, if not our best employee. I believe in her fully. And if she can't attend, then she can't attend. I respect that. That's what it is.
So with respect to the 1,000 account, if you discount the earmarks, it looks like it's a net decrease of $410,000.
Yes.
Now,
So
I guess.
Oh, okay. Go ahead. I have the note here.
Yeah, but I just, well, go ahead. Why don't you answer it? Then I got a question.
Yes. So this increase is due in part to the inclusion of the PAC funding, Chapter 257 reserves, and collective bargaining increases. And that's so the FY22 projected spending in the 1,000 account appears to be $1,034,000 more than the FY22 GAA. So the reason for the variance is, as I just indicated, this increase is due in part to the inclusion of PAC funding, Chapter 257 reserves, and collective bargaining increases.
I'm not sure what those are, but when you back out the earmarks, it's a net decrease of 410,000.
So the note I have here is the FY23, the FY23 House 2 budget is $2,131,000 less than the FY22 GAA. The reason in this decreased funding to meet projected need, given the apparent 2022 spending is so high, why would the need decrease? That's your question. Our answer is, as stated in the stakeholder message, this is because the earmarks and PAC funds have been taken out, as earmarks are not included in the governor's budget.
I understand, and I told you the net of that is minus 410. So the specific question I had for you is that in listening to Nate and looking at the numbers, you know, it looks like the people we serve are down because of COVID. There's an issue with, an issue, and I won't, I respect that you can't discuss the specifics of it, but it does appear as though we have increased demand, and for a variety of reasons, fewer FTEs, and that some inefficiency that we hope will go away as we get back to in person. But it looks like, if anything, that the demand for services, particularly with respect to the 1,000 account, will increase, why aren't we asking for more money?
Yeah, so within respect to the FTE count, there's more FTEs now than when I began, than the previous commissioner had. So, you know, number one, the total is higher. I asked for an increase and got it. So the total is higher, as well as the utilization of that total, I believe to be higher as well. Now, there's ebbs and flows in that because there's retirements, there's, you know, all the various personnel reasons. But if you look over time, FTEs are very stable and again, are slightly increasing. I expect we're going to be at full employment sometime soon. So that's a good thing. Regarding the money, we work, and I believe, in the governor's budget recommendation. So that's it. Now, in the legislature, in their infinite wisdom, if they choose to give us more or less, great. I'm going to testify on Tuesday as to the any questions that they have, and you know, some of the specifics that we're even going over here today. So, but I believe in the governor's budget recommendation. I think it gives us ample funds to be able to serve the people that we're serving. I have heard, and John, are you there? Are you back? Or any of our team? There's been very few out of the 25,000 people we serve. I haven't heard of any instances where somebody has gone without. We're getting the services out there as best we can. At the end of the day, it's up to the consumer to take the services. We spend the large amount of our time trying to encourage people, come on, take the services. That's a big part, particularly in VR. That's a big part of what we're doing there. So we're trying our best. I think we have adequate resources, and I think we'll be able to handle any demand that comes. I do. Now, are there challenges in some areas? Probably, but we'll work through those. And if we need more, then we'll ask for more. But
Yeah.
let's not forget, we reverted a lot of dollars. So, I mean, we're trying our best to spend it. Every meeting I have with the staff, I conclude with spend, 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 get people what they need.
I appreciate. So again, I don't want to get into judgment on caseloads because I can't, I don't know, right? But if there is an instance where individuals have higher caseloads than they normally have, or what they're contracted to do, or what have you, and it looks like at some point in time we could have a tsunami of additional consumers coming in as doctors make more referrals and so forth. It seems that without additional earmarks, there may not be enough money to serve, you know? I mean, that's what all of this suggests.
All right. I mean, that's your assertion. I disagree, but we can agree to disagree. That's a great part about our system.
Anybody else on the SAB have questions?
This is Amy. I believe we skipped over something. We've been kind of going around. I guess I'm continuing to get, and I know from recent months that MCB is planning on getting a new phone system. I'd love an update on that process.
Sure. Yes. Thank you. We have been actively involved, and we've committed to some new things since last month. Is we committed to bringing 509 representatives, 509 for those out there, that's our union representation, them as an additional stakeholder. So the stakeholder community that we've been outreaching to, which includes the eye care community and the consumers and various groups, NFB, Bay State, the vendors that we mentioned, consumers directly, all of them will be in on a process that's called requirements gathering. We've engaged with Konica Minolta Business Systems, KMBS, to be our vendor for that requirements gathering. That kickoff meeting was today. Our Chief of Staff, Camilla Dragoj, is helping to lead that effort. She's the project manager on that. So you're going to start shortly, within the coming days and weeks, seeing messaging and outreach from MCB to the community, basically asking them, hey, what do you want out of a new phone system? What features, do you want it to be automated voice? Do you want it to be live answer? Do you want it to be push button? Do you want it to be able to text?
And this, great, that's good news. This messaging, how is it going to be sent out to people?
Yep. We'll use all our channels. We'll use direct mail. We'll use email. We'll use phone calls. We'll use meetings. We'll use social media. We'll use the group.
I think it's going to be very important to use phone calls. And the reason I say that, and I know as I say that that's time consuming and that sometimes people just don't answer the phone if they don't recognize the number. But I think the people, at least in my extensive experience with the population of seniors, is that many of them who have the most difficulty with the current system are people who are not as facile, don't use electronic communications and really use the phone, or try to, and sometimes have difficulty using the phone. So I would just encourage you to make sure to have a component of contacting the phone users by phone, because this is the very group that has the most difficulty.
Yes, thank you. We're cognizant of that. That's part of our plan. And again, we're going to be getting consultation from KMBS. And, our intent is to try to reach as wide of an audience as possible, to get as much input as possible, because we're only going to get one shot at this. The system has been in place for decades, or a long time anyways. And, if we get this right, hopefully it'll be able to be in place for a while. And, people can become accustomed to it. And so I'm confident that with all the technology out there, we're going to get something that works for a large amount of people.
David, this is Kim, and I just wanted to follow up on and concur with Amy, certainly, but I wanted to ask specifically, you referenced this fact-finding process that you're about to go into, and I hadn't heard that term. I wanted to capture it again. That started with an R.
Yep, requirements gathering.
Requirements gathering. Okay.
And that's what's in the statement of work that we have with Konica Minolta Business System, is to help us with the requirements gathering. And a big part of that is community outreach. And again, we'll use all our channels, all the modes. We're going to try as far and wide to get as much input as we can.
Great. And the part of the reason I ask is that the
Perkins is looking
Library is going through the same kind of thing.
know.
And I hadn't heard that term, and I obviously don't want to miss that step. It's crucial to the success of getting the right kind of system. But
absolutely,
I can't stress
and really one of the things we hope to do is
the importance of kind of the low end users' needs are so important. But I absolutely agree that there's a lot of bells and whistles that many of our consumers can use. So it really is challenging to get a system that can do both ends of the spectrum, but that's what
absolutely. And I don't want to underestimate the consumers, because again, prior to COVID, if you said to consumers, you're going to have to join a Zoom meeting, they would have been like, no way. No, now they're all joining, everybody's joining, and that's a good thing. Same thing with the iPhone. We have people, Mr. Pooler can get out here, Alexander can, and tell you, I don't want the iPhone. I don't want the iPhone. You give them the iPhone, you train them, you can't pry it out of their hands. You know what I mean? So I never sell our consumers short. You know what I mean? So that's part of it. The other thing too that we're cognizant of is, we hear it all the time. Oh, our system's accessible from the vendor. Yeah, great. Then you get it and you try it and you realize this feature isn't accessible, or it's less accessible. Like what we just talked about with Amy. Like, we recognize that there's so many different configurations and everything else that you got to just work through it. So invariably, we're going to be working to make the system accessible even further than what it's going to come out of the package with.
Thank you.
You know, and once we end up with that, that's going to be good for the community, because then, yeah, then Perkins can use it. Then you can, you know, whoever else wants to use it. I mean, then it'll be a thing. So we're like enhancing the value of software for these private companies. We do it all. The state government does it all the time. Like when I was at MOD, all these things we're making, you know, and then they learn. That's a good thing though, because ultimately they're making it accessible for more people.
I had another question, Joe, and I know time is getting a little short, and it
Yeah, it
isn't
is.
specifically about the budget, but I wanted to have it addressed today, and that has to do, if I can, the topic of the assessors and the MCB collaboration with sharing data.
Yep.
Yeah,
and I
that's
wanted
on
to-
the agenda, so why don't we cover that now?
Okay.
Yes.
So I wanted to hear kind of where that is, and I also wanted to basically express a little bit of a concern from what I read in the regulation draft, that all consumer, you know, listings in a given community would be provided to the assessor's offices, and I'm a bit concerned that perhaps that's more data than the assessor's office might need, because not every consumer is a homeowner for property tax reasons or excise tax reasons. And I'm just wanted a little more rationale why all names and all data would go to those communities for this process.
Yes, thank you. So for those new to this, MCB is proposing to change our regulations to be able to modernize the manner and process with which we provide the validation that the consumers are legally blind to the local assessors, that for real estate tax abatement purposes and excise tax abatement purposes currently rely upon the paper certificate of legal blindness. We're trying to make that electronic. So that's the context that we're in here. Now, within that, what we've done is working with the Assessors Association. We had a dialogue going with them, and working with the Department of Revenue's Division of Local Services. We've begun a dialogue with them. We've said, hey, how best can we do this? Because if you remember, what we did last year was we proactively printed and mailed out everybody a certificate of blindness ahead of, there's two big dates. In cities, it's one date, in towns, it's another. One happens in the spring, one happens in the fall. But that's the wave of these local assessors sending out the forms that they need to then provide to the Department of Revenue to get the tax abatement approved and all that. So essentially what we're Kim, yes, thank you for pointing it out. Essentially what we're trying to do here is we're trying to do away with the paper, and we're trying to make it electronic, which we believe will be more secure because it will involve the Department of Revenue's already established system. They have a Dropbox system with the assessors. The assessors are already like bonded and certified. They already handle very sensitive data using this system. So we're not inventing a new system. We're just using an already existing system that the local assessors use on other abatements and other financial information for various individuals throughout the Commonwealth of different statuses and everything else. So we're going to use that system, which we believe will make it more secure, number one. Number two, the data that we're going to provide, we're not providing Abington. Abington is one of the first names on the list of the 351 cities in town. We're not providing Abington the entire list of every MCB consumer. No, we're providing Abington the consumers in Abington that are over the age of 18, and all we're providing is the address. that's what we're, at least that's what we're proposing in the regulation. 1 week from today, we would like to hear from you all, the public, in the public hearing. It is your chance to be heard on this proposed regulation change. Next Friday, the information is on our website. We can resend it out. We've been promoting it and sending out. The listing was in the Globe. It's been posted. Lauren, are you there? Is Lauren here? Or Carla? Lauren and Carla have been working diligently on this issue. We're trying to get the information out there. So please tell your communities to contribute to the public hearing process next week. And it's a step in the process, and we hope to refine it further and make this more efficient for the consumers and for our team.
And thank you, David. I appreciate the convenience factor. It makes a lot of sense to me. The one piece that I do have a little bit of a concern about is whether or not there can be an opt-out option for a consumer.
Yes, we have contemplated that. Yes, we think that is, yeah, if you feel that's something to bring to the public hearing, if you feel that is not overt enough in the regulation, then we will bolster that. That's good input.
Okay, I appreciate that. I'm not disagreeing with what you're trying to do, because I do see it as something that's, going to be a benefit to any consumer who has to, file the paperwork with their town to receive the abatement that they're eligible for. And getting all the paperwork together is always a chore.
Yes.
So
and we know there's people who don't even think
is positive.
I'm sorry, I didn't mean to overtalk.
Yeah, I mean, anything we can do to make that a positive thing, I'm all for that. I just want to be sure that there's an opt-out process.
Yes.
If somebody was really uncomfortable and did not want to be a part of it.
Absolutely, absolutely. We want to do that.
Okay.
That's in our plans. And further,
and I'm not able to attend next week's hearing, so I am going to presume that you will take what I've said today as my comments.
Or we'll take written comments, send them in. Get us any way you can. And further, Kim, here's the other thing. There's a lot of people that don't even know they can get the exemption. We're gonna get calls, mark my words, we're gonna get calls from consumers being like, hey, thanks, we got money back, we didn't even know, or you know what I mean?
Yeah.
So
this is Amy. I just want to concur. I mean, I can see the tremendous advantages of this, but I do think that I want some protections for people who cannot take advantage of these tax abatements, so that their information doesn't get transmitted. That's a privacy issue.
Yes, Lauren scrutinized that greatly. I think that the assurance that we got that the system that the assessors, the Department of Revenue Division of Local Services system, which I can't remember the name at this moment, but that system, the assessors are already very comfortable operating in that system, and that system is highly secure, very secure. Like it's handling just as, if not more, sensitive information than what we're using it for. So we've been given the assurance, and we're convinced that that should avert your concerns. We recognize those concerns, and we think we can solve for it.
Sorry, we're running short on time, and unmute myself. The last item is there any progress on the update of the statute?
No, there's really none. Matter of fact, that might be in a holding pattern because of dialogue that we've had with HHS. So, we're right now we're having internally, I mean, there's only so many hours in the day. We've got a lot going on. We've got like a lot of project managers that are just already tasked out. And so I think it's a function of time. I don't know, like it's back burner at this point.
All right, Kim, anybody have a comment on the SAB?
No, I don't. I'm
No.
good.
All right, we forgot to approve the minutes, so I move to approve the minutes for the previous meeting.
Second?
Seconded.
Second.
Okay, all in favor?
Aye.
All right, done. So in the last few minutes, there's I know Debbie has her hands up. Debbie? Or her hand up, not hands.
Hi, can you hear me?
Can hear you fine.
Yeah, okay. This is Debbie. I'm a consumer. I kind of have like a statement and a kind of question. If you just give me a minute. I just feel like there was like, to me in the beginning, like a little contradiction with my understanding from the commission that that everything was good with the ratios between consumers and employees, and that sorry, and that at the same time the commission, with all those numbers of people joining the MCB, anticipates so many more consumers, and the backlog is going to bring in more consumers. Yet then we hear from people who actually work with the consumers, and they say they are already well over their ratios, and have been for some time. That to me, just as a consumer, looking from the outside, it just feels like there's some like lack of planning or something to know that you're an agency that's growing and that you haven't grown your employees to meet more consumers. And I don't know, it just seems like so obvious to me that it would have been anticipated during all this time that we have overworked employees. We're way behind in how fast and furious all these new people are coming in. They're going to come in, and the guy said you got a new system, Nate, that's going to make it from 45 minutes to 2 minutes. So in an hour, we're going to have 140 new people, and that means we need 2 more people working. I don't know. It just kind of made, I mean, I just found it a little like, it doesn't seem like it's that difficult. It seems like you need more people, but and my question was, the other thing I've been hearing consistently all along is how much money the commission has and how it seems to be just falling from the sky. And why wouldn't this money be given to, be allocated, I guess is the word, to hire people? I don't know. These are just, to me, it just seems so obvious. I'm obviously not, on the inner workings of things, but as a consumer, this is what affects me, is the ability of my coach, as I say, my counselor, to come and see me. And if they have 70 people or 80 people or 120 people, is obviously a big difference. And if people aren't getting hired, all these people that Nate said are on their way and coming in, I just don't know who's going to handle them, but that's, I guess, not for me.
David, do you have an answer to that? I'm just, and Debbie, I apologize for that title.
Yeah.
I can't address the first part. That might be construed as labor negotiations. What I would say is we're working, what's been presented here, Debbie and others, is we're talking about new people coming in. I want to be very sensitive and empathetic. What we're not talking about, unfortunately, is the people who leave MCB. And that happens very significantly. In some quarters, it far outpaces or outpaces the amount of people coming in. And it's usually, unfortunately, through death. So we haven't discussed that. So we produce our annual report and so I would point you to that. If we look at the registry, it's been very stable over time. I do think we've modestly increased people based upon the successes that we've had. Then complicating that came COVID. So it's difficult to get a very crystal clear picture. We've endeavored to do that with some of the surveying that we've done. We're keenly interested in that. Like our Turning 22 program, very specifically. If one person leaves that account, that can literally be hundreds of thousands of dollars worth of spending. 3 people can be $1 million from that one program. So we spend a great amount of time and energy trying to forecast who's coming in. The AIM library now, we're trying to construe and innovate ways with which we can even improve our feeder system more with the youth. So we're trying our best. It's challenging to do. We rely on our community partners also a lot of the times. We rely on the eye care community. So I hope that answers your question, Debbie.
Kind of, but I mean, I still, it just seems that I understand that people die empathetically, but I understand that people live longer, and that's just going to continue to happen. And I understand that people are going to be more comfortable with, of course, those great programs and advertisements and things you put forward, like we said, to not be shy, not be ashamed, and not be embarrassed, and join, get the services and the community and the support that you all provide. But you can't provide any of that if your employees can't get to us. So
Maureen, do you have something to close it off? We got 2 minutes. Maureen,
Okay.
did you have something?
I'm a consumer. I was diagnosed as being legally blind back in either 2018 or 2019. When I was told, I took myself off the road. I stopped driving. But at that point, was very quick to notify the registry that I could no longer drive. But I actually felt like I had been dropped in the middle of a rotary and told to find my way to the sidewalk because I had no one who reached out to help. I don't understand why MCB can't be more proactive with newly diagnosed individuals rather than us having to go scratching to try to find support. When I originally reached out incorrectly, I went to the ADA and was told I fell in the cracks. So it has only been through mostly word of mouth that I have found out what was available. But I also find that I have been waiting since last August when I'm a homeowner, I'm a single person, I'm over 80. I was told last August that I qualified for Alexa, and I requested a talking blood pressure cuff. It has yet to been delivered. I reached out to my state representative, my support person a week ago, and received a phone call yesterday. But I don't think people who are seniors, who are blind, should have to go scratching to try to get help, nor should we have to reach out networking to somebody else who knows someone within the commission. You should be more proactive for people like us.
Maureen, thank you very much.
So the manner with which the process works is we can only start providing programs and services when we get a mandatory report of legal blindness from a person's eye care provider. Once that happens.
That happened, Commissioner.
Okay. Oh, yeah,
Maureen, Maureen, we're back on March 11th. Please come back on. Everybody be well, be safe. The next meeting is scheduled for March 11th. I know that people have schedules to keep to, and we'll see.
Maureen, have you been outreached to yet, though, by our counselors?
I'm sorry?
Have our counselors contacted you yet?
I'm not sure what you mean by counselors. I'm involved very much with MABV now.
Okay, as MCB.
Also, Jim Badger was very active with me. and I enjoyed the one-on-one meetings with Jim. But I
Okay,
also understand the COVID situation. So I have no issues that way. But I'm just saying, consumers have to be proactive or they don't find out what's going on.
Well, let me find out about that because you should be being outreached to, and I apologize that it's taken so long.
Thank
Joe,
you,
this is
everybody.
Kim, and
Oh,
I
sorry.
just wanted to reiterate that I will not be at the March 11th meeting. It was a date that was not available on my calendar to hold a meeting, so I won't be able to be there.
All right, so what we'll
Okay.
do is we'll see if we can't move it around. We'll do it with the commissioner and Regina offline.
Yeah,
as
I had
well.
indicated March 11th.
Yeah,
wasn't gonna
now
work
I
for me.
remember that. I think
Yep.
we had trouble tying it down.
Okay.
Okay, thank you.
Thank you all.
Thanks, everybody.
Have a great weekend.